Have you ever considered how frequently the silence of our surroundings is broken by the persistent ringing in our ears? A constant, unyielding hum that accompanies our every moment. This is the reality for 1 in 7 individuals globally who are affected by tinnitus, a chronic condition that can lead to severe distress, emotional impact, and societal consequences, including suicide. Particularly vulnerable are our military veterans, with tinnitus being their most prevalent disability. As we stand here in 2024, over 2.7 million veterans bear the weight of this relentless condition. Yet with all these numbers, we find ourselves in a predicament. There's no cure for tinnitus, no drug or procedure that can permanently silence the ringing. Clinical treatment methodologies vary significantly, with no consensus on which treatments are the most effective. This lack of unity leaves a gaping hole in the creation of effective, evidence-based guidelines for those suffering from tinnitus. But imagine a world where this wasn't the case. A world where a systemic solution existed, a solution that didn't just aim to treat the symptoms, but to understand, to learn, to improve. This is where the proposal for a Tinnitus Learning Health Network, or TLHN, comes into play. Learning health networks are multi-site, practice-based clinical networks that engage patients, clinicians, and researchers. They collect data embedded in clinical practice and use it to improve care and guide research into better solutions. The creation of a TLHN represents a shift from the current siloed healthcare system for tinnitus to a more inclusive, effective, and data-driven approach. This network will start small, with a pilot network of 5 to 7 sites in the first year. Over the next 3 years, it will expand to 20 to 30 partner sites, with a goal of reaching 50 sites within the next 5 years. The initial network will focus on selected VA/DoD healthcare centers that treat veterans who suffer from tinnitus, then expand to private institutional providers, and finally community clinics. The growth and development of this network will not happen overnight. It requires time, commitment, and crucially support. Foundation and federal grants, industry donors, healthcare insurers, and private individuals are all potential sources of funding, providing the necessary resources to make this vision a reality. So consider this a call to action, a call to support an initiative that seeks to bring solace to those suffering from the relentless ringing of tinnitus. For inquiries, reach out to Mr. Jeffrey Reagan, the founder, at support@stopthering.org. As we move forward, remember, every ring we silence is a life we improve.